Hi, my name is Sophia, second year kinesiology student, and this is my final practical video. So today we're going to go through client 1, or Hannah's workout program. So we're going to do her Friday workout program from her weekly schedule. So the first question I'm going to answer today is, would I classify Hannah as a beginner, intermediate, or an advanced client? Hannah is a beginner client because she has not trained in over 10 years. And in addition, her poor sleep schedule of 4 to 5 hours in combination with her poor diet, because she eats out 4 times a week, would significantly impact her overall fitness level and her energy levels. So in addition, because she hasn't worked out in so long, the principle of diminished gains kind of comes in. So she hasn't lifted in the gym, she hasn't picked up weights. The most activity she has done based on her Get Active questionnaire is running around with her children for 30 minutes a day of moderate to moderate physical activity. The next thing we're going to talk about is Hannah's risk low, moderate, or high? The ACSM stratification chart gives trainers an outline as to their client's level of risk of an adverse reaction to exercise. And going through Hannah's case study, she's classified as moderate risk. If we go down the chart of the ACSM stratification, we can see that she doesn't have any previous history or diagnosis of cardiovascular disease or diabetes. However, as outlined in her Get Active questionnaire and in her case study background, she only gets about 30 minutes of moderate physical activity per day when she's playing with her children, as well as in combination with her diet and the fact that she's a desk receptionist and she sits down all day. So her job leads to the point that she may live a somewhat sedentary lifestyle. In addition, she is only 162 centimeters tall, which is about 5'3", and when you calculate her BMI for her being a weight of 185, her BMI is 32.8, which is classified as the overweight category. So obesity is another risk factor. Therefore, because of those two factors, she's categorized as a moderate risk client. The reason why Hannah's workout schedule is laid out the way it is, where she has Mondays as the full body resistance training program, Tuesdays into a cardio session on the step mill with a Wednesday break, and then Thursday back into our HIIT session, which is another type of cardio or circuit training, and Friday into another full body resistance training session. The reason why it's scheduled that way is because her availability from her case study outlines that she's only available during the week for an hour at a time. So to accommodate for that and to make sure that she gets the amount of rest that she properly needs to achieve her goals and to get the best possible results, we split up her sessions in the week, giving her Wednesdays as a rest break, and then Saturday and Sundays as also a rest and recovery and stretching type of days. And the last thing I'm going to touch on is why I chose the 3 sets during our conditioning phase, 3 sets, and why I chose to do between 10 to 12 reps per exercise. So the ACSM guidelines for hypertrophy and muscular endurance, the main goal being hypertrophy, is to have your reps between 8 to 12. It would be hypertrophy as the main goal, and then your secondary goal, which is pretty close to it, would be muscular endurance. So doing 10 exercises or 12 exercises is a nice medium in between the two. As well as she is a beginner client, so doing too high of exercises and going too far into muscular endurance territory might not be as beneficial for her goals. 3 sets as well as part of the ACSM guidelines for any sort of a hypertrophy goal or hypertrophy exercise. And the reason why I did 30 seconds is, again, because it's a nice medium between muscular endurance, which is anything less than 30 seconds, and hypertrophy, which is anything between 30 seconds and a minute and a half for rest time. So the first exercise that we're going to start with is high knees, and this is going to really raise our heart rate and get us ready for our workout. So high knees is really going to work our glutes, quads, hamstrings, and core, as well as our calves. So this exercise is going to be 2 sets, 10 reps per leg, so 10 knee drives per leg. So first we're going to start off just standing tall upright, keeping our core engaged, back in a neutral position, not hunched over, nice and straight, head up. And we're going to pretend like we're running on the spot basically. So we're going to start by driving one knee up towards our chest. Opposite arm, opposite leg. Driving one knee up, trying to get that 90-degree angle as we come up with our toes pointed up, flexed. So we're going to opposite arm, opposite leg, drive our knee to our chest with one leg, 90-degree angle, and drive back down to the ground. And then we're going to alternate. Opposite arm, opposite leg, 90 degrees, toe up, drive, head forward, back in a neutral position, core is engaged, and drive back down. So the full movement will look something like this. If that full movement is too hard for the client, what we're going to do is we're just going to regress it. So instead of doing high knees up and down really fast, we'll do walking marches. Same movement pattern, just up, down. Opposite arm, opposite leg, same movement pattern, just at a slower pace. And eventually, we can work up to that faster pace. So our next warm-up exercise is going to be quad walks, and this is really going to help warm up our hamstrings, our quads, our glutes, and our lower back, our erector spinae. So what we're going to do is we're going to start off by getting ourselves some space on the mat, and what we're going to do is we're going to take a step forward. We're going to lift one leg. We're going to make sure that this planted leg is underneath our hips and stacked properly, so we're fully balanced on this side. Now we're going to bend our one leg, grab either at the ankle or as best as you can, closest to the ankle, but as best as you can, maybe even the toes. Now the important thing when doing the quad walks here is that we're not tilting to the side and bending over and breaking at our hip and at our back. So we want to grab at the ankle, bend, our knee should be pointed down towards the ground as best as we can. Core is going to be engaged. We're going to look forward. Our back should be in a straight and neutral position, and you should feel that stretch running through your quad, maybe even your hip flexor and your glutes. Now we're going to alternate, and as we walk forward, we're going to do our left leg. Now we're going to walk again forward, and same sort of mechanics. We're going to grab our ankle of our bending leg, keeping our balance, making sure that our knees aren't collapsing inwards either on our balancing leg, keeping our knee pointed down towards the ground and not out like this. So we're bending at the back. Keep our knee down towards the ground, feeling that stretch in our quad, core engaged, back in a neutral straight position, head forward, and feeling that stretch in our quad. Now we're just going to walk and alternate this movement. So we're going to do this exercise for 2 sets again, 10 per leg. A regression exercise of the quad walks is to take off the walks totally, and we can just do it stationary. So you can have it holding onto a wall to make it easier on the balance aspect of it. And if we can't reach our ankle, we can just try and find a bench. A regression of the quad walks would be to take away the walks completely and then add some stationary aspects to it. So you can have your hand on a wall to help with the balance aspect. Same mechanics here, hand on the wall, knee stacked, not buckling our knee in and out. Pushing to the floor, getting our balance. Now instead of maybe we can't reach our ankles, so maybe we put it on a bench or a chair or even a step up platform. And adjust the height of that to make us feel this quad stretch. A progression of the quad walks now are to keep the movement, but now when we take our quad walk and we step forward, so grabbing at the ankle, keeping our knee as best as we can to be in line with our body and not breaking at the hip or the knee. Then engaging our core, keeping our back in a straight neutral position. And now we can now let go. Hip hinge at the hip, so pushing our butt back without bending our knees. Let go of our ankle and reach forward. Again, making sure we're not breaking at the knee, keeping our head up, back in a neutral position, and bringing back to the center. And that's going to further work our glutes, our hamstrings, our quads, and all the muscles that the glute walks originally warmed up. Our next warm-up exercise is going to be the forward and reverse shoulder rolls. It's going to help warm up our trapezius, our levator scapula, which is our neck muscles, our deltoids, and our rhomboid major and minor, which is a deeper tissue, but it's all part of our rotator cuff, so it's going to really help warm up our shoulder. Another thing this warm-up movement will help is with this client's shoulder impingement. She can't reach over her head without feeling a little bit of pain in her shoulder because of that impingement. This is going to help warm up the muscles around it, so that way she has better movement throughout the workout. So this exercise is going to be done 2 sets and then 10 forward rolls and 10 backwards rolls. Okay, so the first thing we want to do is we're just going to start off standing nice and tall in a athletic stance, feet shoulder width apart. We can have our core engaged for stability. We just want to make sure that we have our back in a neutral and straight position. Hands can be by your side, and we want to roll our shoulders forward. And then we're going to roll our shoulders forward in a slow and controlled motion. And then the next part of that exercise will be to roll it backwards. So one progression that we could do for the forward and back shoulder rolls is to add some weight. So you can add as light as 5 or as heavy as, I wouldn't go past 7 or 10 because it is a warm up. So we're just going to start same mechanics, core engaged, head up, neutral spine, and add that roll forward. And then that roll backwards. And then a regression of this exercise would be to do it one side at a time. So only rolling your right side first, and then switching and alternating, only rolling your left side. And then of course, doing the same movement in the backwards direction, with the same amount of sets. do a walking hamstring sweep. So this is really good for our hamstrings, as well as we might feel a little bit of stretch in our calves and in our glutes. So we're gonna do this warm-up exercise, 2 sets, 10 per leg. So what we're gonna do is we're going to first start off in an athletic position, feet shoulder width apart, head up, core engaged, and back in a neutral straight position. Now what we're gonna do is we're gonna step forward with 1 foot, keeping our heel on the ground. We're going to pretend that we're sitting our butt back onto a chair, pushing our hips back. This is called hip hinge. So we're going to hip hinge and push our butt backwards, feeling that stretch already, and then keeping our chest up, back in a straight position, head up. We're going to reach, bending slightly at this knee, reach as far as we can to the ground. Reach, swing, feel that stretch, swing back up, and release at the hip hinge. Start back at the beginning. So from the side, it looks something like this. Stepping forward, heel on the ground, toe up, head forward, chest up, back in a straight and neutral position. We're going to sit our butt back, hip hinge, already feeling that stretch. Slight bend at the knee as we bring our arms down and we sweep up, keeping our chest and head up through the whole movement. Now, a progression to this exercise would be to use a bench or a chair. Now, using the bench or the chair, you can have the client sit on the bench, one leg extended, one leg bent. We're still promoting that hip hinge, bending forward but not breaking at the back. Promoting that hip hinge, having our heel on the ground, toe up, and the extended leg straight. Keeping our chest up, our back in a neutral position, and our head forward. We're going to try and reach as best we can as we hip hinge towards our toe. And you'll feel the stretch in your hamstrings and your calf. And then come back up. And we can alternate. Toe up, heel on the ground, hip hinge without breaking at the back, forward, chest up, and reach. A progression of this exercise would be to add a hop or a skip in between our stretches. So as we are doing our walking hamstring sweeps, we could add a skip or a little hop just to get our heart rate up even further. So it'll look something like this. So the first exercise we're going to do in this series is split squats. So split squats are really good because they work our glutes, our quads, our hamstrings, and our core. So for Hannah, we're going to start off using body weight for this exercise. We're going to start in our athletic stance, so feet shoulder width apart, chest up, back in a neutral position, a straight spine, and head forward. Now we're going to take an exaggerated step forward with one leg. And as we step forward, you're going to notice our back leg, our heel is going to come off the ground slightly, but that's okay. For our front leg, we want to focus on keeping everything stacked. So hips stacked on top of knees, stacked on top of our foot. And we want to push through our heel, putting all our weight on our heel for this movement. So pushing through our heel. Now it's important that we stay balanced. So for body weight, we're going to either put our hands to the side or hands on your hips as we're going through the movement. Now we want to make sure that our knees don't collapse inward like this or too far outward like this as we're going through the movement. So from this position now, we're going to keep our back in a straight position, so our spine is going to be straight. We're going to engage our core, and then from there, hands on our hips, balance, and we're going to bend our back leg and our front leg until we reach about 90 degrees. Again, making sure that our knee doesn't fall inward or outward during the movement. And we're going to push through our front heel again, back to starting position. All right, and then we're going to alternate that, stepping forward, pushing through our heel, stacking our knee on top of our hip, and in line, coming down to 90 degrees, making sure we're not collapsing, and pushing through our front heel again, back to starting position. So one way that we can progress this exercise further is by adding weights. So because Hannah hasn't worked out in a very long time, hasn't been in a gym setting for a very long time, we're going to start off low with our progressions. So I'm going to use 5-pound dumbbells and demonstrate this exercise with the progression. With the same mechanics, we're just, instead of holding our hands at the hips for balance, we're going to hold the dumbbells by our side as we step forward, and then we come down into the movement and back up. Another progression is to add an elevated surface like a bench and move into something called a Bulgarian split squat. So we're going to do 3 sets of 12 for this exercise. So it's going to be 12 per leg. And then we're going to have 30 seconds rest after each set. So one regression that we could do from the split squats is to start from the ground instead of starting off standing in our athletic stance. So we're going to start by kneeling, and if you have one of these blue pads, they just support your knees. So starting off kneeling, toe curled underneath you, knee stacked on top of our ankle. Again, we're not letting it collapse or go too far out. Hands on our hips, back straight, chest forward, head up. And then we're going to push through our heel just as we did in the regular split squats, up to our starting position. And then lowering back down, and then coming up, and lowering back down. And then again, alternating sides. On the side, it looks something like this. Go ahead. So the next exercise we're gonna work on is the single arm dumbbell row. So it's a single arm kneeling dumbbell row. We're gonna do it on a bench today. So this exercise is really good because it especially works out our shoulder muscles. It works our lats, works our trapezius muscles, our rhomboid majors and minors, our deltoids, our pecs. It's really good for the shoulders. And it's going to be especially good for Hannah to help strengthen her shoulder with that impingement that she has. We're going to do 3 sets, 12 per arm, with a 30-second rest in between sets. So the first thing we're going to do to get set up for this exercise is we're going to not use body weight. We're going to use 5 to 10 pounds for Hannah because she's starting off and it's her first time doing these type of workouts. I have 5-pound weights, so for the sake of demonstration, I'm going to demonstrate with my 5-pound dumbbells. So for this movement, we're going to start off by placing our knee on the bench and stacking our knee above our hip. And the other leg that's extended, we're going to put about shoulder width apart as well. Now, you can have your toes slightly pointed out. You can have your toes pointed forward. Try not to have your toes pointed in because then that promotes bad knee movement and it's not really good for you. So we're going to athletic position, foot stacked on top of hip, shoulder width apart, knee on the bench bent at a 90-degree angle. From here, we're going to make sure we keep our flat back, our straight spine, and we're not collapsing, right? Keeping our chest up. We're going to hit hip hinge, so pushing our butt back. We're going to have a slight knee bend on this outside leg that's planted. With that slight knee bend, it's going to help us get our butt further back as we hip hinge. From here, we're going to place our hand on the bench, and we're going to stack our hand and wrist on top of our shoulder. Now, again, keep making sure our back is flat and not rounded like this or turned. We're going to squeeze our core and engage it, pick up our weight, and let our shoulder fall. Now we're going to pretend that we have a spring attached to our shoulder blades and we're going to pull them back and really engage them. From here, we're going to lift the weight, bending our elbow, keeping it as close as we can to our body until we reach our chest. The dumbbell should just come up to your chest. Again, keeping our elbow as close as we can, making sure we're breathing throughout the entire movement, and lowering it back down to starting position. Again, squeezing the shoulder blades together, pulling up, dumbbell towards the chest, elbow close to your body, breathing again, and bringing it back to starting position. A progression to this would just to be add more weights. So adding, instead of starting off with 10 with Hannah, you can maybe add 5 more pounds to do 15s, and then eventually work your way up and progress further. So one regression that we can do for the single arm dumbbell row on the bench is instead of adding more weight, we can start off with using just our body weight and just working on squeezing at the top and the movement pattern, and then progressing towards adding 5 pounds, then 10, and then 15, and so on. Our next exercise is going to be a core dominant movement. So we're going to do alternating heel touches, and this is really going to work our rectus abdominis, or our core, and as well as our obliques. For this exercise, we're going to do 3 sets, 12 heel touches per side, and with a 30-second rest in between. Starting off, we're going to start off by laying down on the mat. We're going to lay down on the mat, keeping points of contact with our head, our tailbone, and our feet, both on the ground, knees bent. From here, we're going to engage our core by squeezing. Our tailbone should be on the mat, so there shouldn't be any space here when we're doing this movement. So you don't want to have this open area that you can fit your hand through. You want to engage your core, squeeze, and then you don't have any room for my hand to fit through. Okay? So again, engaging our core, squeeze, feet on the ground. We're going to place our hands on the ground by our sides like this. Now all we're going to do is try and reach our fingers, alternating sides, trying to reach our toe. So again, keeping our core engaged. We're going to slightly lift our head off the mat. Shoulders are still touching the mat. And we're going to rotate, try and touch our heel, come back to the center. Rotate, try and touch our heel, come back to the center. One progression that we could do for that movement is we can add a crunch between touching our heels, which will look something like this. One regression that we could do for this exercise is, instead of trying to reach our heels, we can place dumbbells to the side and try and reach them a little off the side, so there's less range of motion that the client has to do to get to their heels. And it'll look something like this. Here's what it will look like. So the next exercise in this series that we're going to go through is the lateral band walks. Now you want to find yourself some space. I'm in a limited space here, so I'll just do a side-to-side walk as part of the demonstration, but ideally you want to be able to walk a distance one way and back, almost like in a set distance with cones. Now for this exercise, we are going to start off using our heavy resistance band as our weight. This exercise is really good because it works our adductor muscles, so our inner thigh, our quads, our hamstrings, as well as our glutes. And it also helps a little bit with our core. So this exercise is going to be done 3 sets. We're going to do 12 per side, so 12 going to our right and 12 going to our left. And we're going to have a 30-second rest in between. So starting off, we're going to put our resistance band just over our knees on our thighs right here. Once we have the resistance band on, just above our knees and our thighs, we're going to start off by standing in an athletic position. So standing feet shoulder width apart, with our back in a straight position. So we want to make sure that our feet are either facing forward or slightly turned out when we're performing this exercise. We don't want to have our feet turned in, because then it promotes our knees collapsing, and we don't want that. So we don't want our knees to collapse in the exercise, and we don't want our knees to be too far out, and we lose our stability in our feet. So we're going to start off in our athletic position, feet shoulder width apart. We're going to hip hinge, so we're going to sit our butt back, bending our knees slightly. As we sit our butt back and we push our hips back, we're going to make sure that we're not bending at the back like this or coming too far up. We want to make sure we have a straight spine, keeping it in a neutral position, keeping our chest up and our head forward. Now we're going to slightly lower into a squat, bending our knees more and more. Not a full squat, but about a half squat. From here, again, making sure our knees don't collapse in or out too far, we're going to take a step out. Step out, making sure our knees don't collapse, and step back into our athletic position. Now we're going to step back using our outside leg. Again, making sure our knees don't collapse in this movement. Chest up, core engaged, and step back to our middle position. The lower we go into our position here, into the squat position, the harder it's going to be. So starting off with the lateral band walks, we want to start off in our athletic position, feet shoulder width apart, with the band placed just above our knee. From here, we're going to hip hinge and sit our butt back. So we're going to sit our butt back, making sure that we're only bending at our hip, slightly bending at the knee for now, but only bending at our hip. We're keeping our chest up, but maintaining that flat back, so we're not hunched over like this. We're maintaining our flat back. Head is up as well. So from here, we're going to sit back, bending our knees into a squat position. The lower you go into your squat, the harder the movement is going to be. I'm in about a half squat position here. So from here, we're going to now take a big step out with one of our legs. So I'm going to take a big step out with my right leg. And I'm maintaining my knee. And from here, my knees, I'm going to make sure that they're not collapsing in like this, especially this outside one. The whole point of this exercise is to force and use our adductor muscles and force our knee out, staying in line with our body. From this position, we're going to bring it back into our original starting position by lifting this leg, pushing off, and coming back into the starting position. Then we're going to repeat this again. Taking our outside leg, coming out, making sure our knees aren't buckling in or too far out, pushing our weight through our heel on our outside leg, and coming back to our starting position. Now from the side, this is what it looks like. Again, sitting our hips back, hip hinging, coming into a squat. Now pushing off this leg, off your inside leg, out with your outside leg, not letting our knees collapse. Back is straight, not collapsing, our chest is up, core is engaged. Pushing off the outside and back to the middle. The lower we're going the squat, the harder it is, the harder the movement's going to be. A regression would be just use our body weight or even a blue band, an extra light band. Same movement pattern, hip hinge, come back into a squat, chest up, back in a flat position, not collapsing, head up as well, engaging our core, pushing out, coming back in, pushing out and coming back in, pushing out and coming back in. And then a progression would be to add, say I don't have a 10-pound weight, but say a 15-pound dumbbell in the goblet position. Again, hip hinging, coming down to a squat, and moving side to side, making sure our knees and everything stays aligned and is not collapsing. So our next exercise is going to be the dumbbell chest press, but laying on the floor. The reason why we're doing it on the floor is because Hannah has a shoulder impingement. Now the dumbbell chest press on the floor helps work our deltoids, our triceps, our biceps, our pectoralis muscles, basically all the muscles in our shoulder. It's also going to give us a little bit of a core workout as well, because we have to squeeze our core and make sure we don't have that gap in our back as we lay on the floor. This exercise is going to be done in 3 sets. We're going to do 12 reps in total, and then we're going to have a 30-second rest in between each set. One regression that we can put to this is, instead of starting our hand off with 10 pounds, maybe we cut it back to 5 pounds, or even use a TheraBand, which is a long resistance band, and work on that motion using a resistance band instead of starting off with weights. Progression of this exercise would be to add on more weights. So we're going to start Hannah off with 10 pounds. However, I'm going to demonstrate with 15 pounds. So if 10 pounds is too easy for Hannah, then we can move on to 15 and so on. And that can be her progression. We're going to start by laying on the floor. So we're going to lay down, putting our feet flat on the ground and bent. We're going to bring our waist close to us right here. So first thing we want to do is make sure that we engage our core. And we want to squeeze our stomach so that we don't have this gap. In our back. If I don't squeeze my abs, squeeze my core, I have a gap, which causes more back pain, which we don't want. So we need to engage our core and squeeze, and then I can't put my hand through anymore, which is good. Feet flat on the ground. I'm going to maintain points of contact with the floor on my head, my tailbone, and my feet. From here, I'm going to carefully pick up my dumbbells, and I'm going to hold it just in line with my chest. I'm going to make sure that my arms are at a 90-degree angle and they're bent. So from here, make sure my wrists are engaged, and I'm holding the dumbbell stacked on top of my elbow. So I'm not leaning too far back or too far forward. That's going to hurt. That's going to hurt your shoulder, and it's going to cause injury, which we don't want. From here, push the dumbbells straight up, and we want to keep it in line with our nipples almost. So we want to push through our chest, through this plane, and push up. From here, again, we don't want to be swaying too far back or too far forward. We want to make sure that the dumbbells, our wrists are all stacked on top of our shoulders. Then we're going to lower back down, maintaining that 90 degree until we hit the floor. Once we hit the floor, we've reached our full range of motion. Push back up in that plane and come back down, making sure we breathe throughout the entire exercise. Once again, our regression could be to add lighter weights. So these are 5-pound dumbbells, and it's the same movement. Engaging our core, making sure we have no space, feet are on the ground, maintaining our points of contact, which keeps our neutral spine. Pushing in line with our chest, so pushing up, stacking our wrists and stacking the dumbbells, wrists on top of our shoulders, and coming back down, keeping that 90 degree once we reach the end. So the last exercise that we're going to do is another core workout, and this is the high plank with shoulder taps. So this is a really good exercise for our rectus abdominis, or our core, our obliques, and it also incorporates some shoulder. So again, it's going to work our deltoids, our pecs, our pectoralis muscles, our trapezius muscles, and it's going to really help strengthen Hannah's shoulder with that shoulder impingement. So this exercise is going to be done in 3 sets. We're going to do 10 reps per arm, so 10 shoulder taps per arm, and we're going to get a 30-second break in between. So we're going to start off this exercise on the mat. So we're going to place our hands on the mat. And when we do that, we want to make sure that we stack our shoulders on top of our hands. So our wrists aren't on an angle. We're going to stack them one on top of the other. Wrist on top of shoulder. Now from here, we're going to squeeze and engage our core as we kick our feet out and come into that high plank position, making sure our core is engaged. And we want to also make sure that we maintain that neutral spine. So a straight spine, which means we're not bending like this or collapsing, especially at that lower back. Now, from that movement, we're going to take one hand and tap our shoulder and bring it back down. And repeat that exercise. Again, making sure that our spine stays nice and flat. As we perform these shoulder taps, we want to make sure that we're not twisting like this and breaking at our back and our core. We want to make sure that we stay nice and straight. Spine is neutral, core is engaged, and tapping as best we can with minimal hip movement. So the regression of this exercise would be to start off on our knees instead of in a high plank position. So again, stacking our shoulders one on top of the other, bending our knees like this, keeping our back nice and straight in that neutral position, so not bending or collapsing, keeping it nice and straight, and engaging our core. From here, we can now perform the shoulder taps. In the same motion, touching our shoulder, trying not to rotate too much at the hips or breaking at our back, touching our shoulder, returning back to starting position. One progression of this exercise would be to maintain that high plank and shoulder tap and add a knee drive. So it would look something like this, stacking our hands one on top of the other, high plank position, engaging our core, back straight, and spine is in a neutral position, core engaged, shoulder tap, knee drive, shoulder tap, knee drive. So now that we've finished our training and conditioning, the bulk of our exercise program, it's really important that we move into a cool down. Now we're going to go through 4 cool down exercises, and these are really going to help promote cooling down our muscles, preventing injury, as well as promotes flexibility and mobility. Figure 4 stretches are really good because they work your glute muscles, your hamstrings, your hip flexors, and your piriformis muscles, as well as your abductors and abductor muscles, so your inner thigh muscles and your outer leg muscles. So we're going to do this exercise for 1 set, 30 seconds, hold per leg. So we're going to start off with the figure 4 glute stretch, laying down on the mat. So we're going to start off by laying on the mat, having our feet planted on the ground, just arms by our side. Again, it's always important that we engage our core whenever we're doing some sort of movement, so we don't want to arch at our back or break at our back. Again, we're going to maintain points of contact for now at our head, tailbone, and feet. Now what we're going to do is we're going to raise one leg, and we're going to cross it over into this position. So our heel is going to sit on just above our knee on our thigh. From here, we're going to reach our hands through and grab our opposite leg. Now, when you do this, your neck and head will come off the ground. So we're going to reach through, grab, interlocking our fingers if we can on our leg here, and we're going to keep our non-stretched leg, so at a 90-degree angle, and we're going to hold this stretch for 30 seconds. seconds. And then we're gonna alternate and switch and do the same movement for our other leg and hold it for 30 seconds as well. One regression of this stretch would be to move it to a seated position. So to sitting on a bench, you can just cross your legs over. Again, ankle just above your knee on your opposite leg on your thigh, and taking your hand and now pushing as far as you can until you really feel that stretch. And then you alternate and do your other side. One progression would be to just pull the stretch closer. Closer you pull your leg to your body, the more stretch you're going to feel in that movement. The next exercise we're going to do is the supine hamstring stretch, which is really going to give us a good stretch in our hamstrings as well as our calves.
Patty run.
Ready? So we're going to do this exercise for one set, 30 seconds hold per leg. So we're going to take our TheraBand and laying down, or sitting down for now, we're going to place our TheraBand on our foot, so just around the midpoint of our foot. We're going to hold the bands. From here, we can now lay down, keeping our non-banded leg as much as we can on the ground. We're going to slowly raise our leg and feel that stretch in our hamstring. Again, making sure that we're not bending at the back. We don't want too much of a gap here. We want to make sure we keep our core nice and engaged. From here, we also want to make sure that we're not bending too much at the knee, because then we won't feel that stretch in our hamstrings. A slight bend is okay, but as best as we can, keeping that leg straight. And from here, you're just going to hold it for 30 seconds and repeat on the opposite leg. To release, slowly lower your leg back down, bring yourself back up, and release the band. One regression to this exercise would be to get rid of the band entirely and just have the client try and reach for their thigh. So keeping their back upright, chest up, have the client reach for their thigh as far as they can and come back. A progression of this exercise would be to use a harder resistance band. So just even one of these, I don't have a thicker TheraBand, but for sake of demonstration, one of these extra heavy bands would work fine. The thicker the band, the more resistance, the better the stretch you're going to be. And again, same movement pattern, bringing it up, and as you bring up, the higher and straighter your leg gets, the more pull you're going to feel in your hamstring. And then releasing and bringing it back down. Our next exercise is going to really help stretch our shoulder muscles because we did so many shoulder exercises throughout this workout. So the arm crossovers is the next exercise that we're going to go through, and they really help loosen up and stretch our shoulder muscles. So our deltoids, our triceps, trapezius muscles, as well as our biceps. So this exercise is going to be done 1 set, 30 seconds per arm. So starting off, we are going to just take one arm in a standing position. We're going to take one arm and cross it over our body, and then with our opposite arm, give our arm a hug and place our hand on our shoulder. Further, we pull our arm closer we pull our arm closer to our body, the more stretch we're going to feel in those muscles. And you're just going to hold this for 30 seconds and help open up. Open up again, switch, give your arm a hug, place your opposite hand on your shoulder, and feel that stretch. So one way that we can progress this exercise is to add a swing into it. So we can swing forward at a faster pace instead of a single hold, which will really help open up our shoulders. So one way that we can progress this stretch is to add a swing into the motion. So swinging and grabbing our arm and hugging ourselves, putting our arm on our shoulder, and then letting go and swinging back again. So it's a little more active rather than stationary, I guess. Then it's a little more fast-paced rather than holding for 30 seconds at a time. So it looks something like this. It would also help open up our chest muscles even more, so our pectoralis muscles. Our regression could be that we use a wall to help support and get that full stretch. So we're going to start off by putting our hand on the wall, just straight in line with our body, and walking ourselves towards the wall. Keep our hand planted on the wall, and you'll feel, as you get closer to the wall, you'll feel that stretch open up in your deltoids, your shoulder muscles, your pectoralis muscles. And again, hold for 30 seconds, and repeat on your opposite arm for 30 seconds. So our last cool down exercise is going to be a myofascial release. It's going to be foam rolling. So we're going to do hamstring foam rolling because we worked a lot on our hamstring muscles, especially with those lateral band walks and the split squats. Foam rolling, especially foam rolling on the hamstring, will focus on releasing the muscle in our hamstring. So we're going to do this stretch for 1 set, 30 seconds per leg. So once you have your foam roller underneath your hamstring, you're going to place your hands behind you, and you're going to plant your opposite leg on the ground. This opposite leg you're going to use to help roll you forward and backwards. So pushing through most of your weight through your heel, you're going to lift yourself up slightly, roll forward, and pushing off through that heel, backwards, forward, and backwards. We're rolling up until the top of our back of our knee, up until here, all the way up until where our glute starts. And then from there, we can just lower ourselves back down, reset, and put the foam roller under the opposite leg and do the same movement. Now, we can either progress or regress this stretch using either a tennis ball or one of these spike balls. If we use one of these spike balls on the ground, that would be a progression because it's a lot harder to move with a spike ball than a foam roller. Regression of the hamstring foam rolling exercise would be to use a tennis ball or a ball like this on a seated surface. So